want to share with you what I know about psychedelics and their potential for supporting therapeutic process, because these substances have been researched quite a lot in the recent years, and studies consistently show that they have a potential for helping with a lot of mental health issues, for example, drug-resistant depression. But there is a caveat here that in most of the studies, the participants not only take a psychedelic substance, but they also get therapeutic support. I'm a cognitive behavioral therapist by first training, which means that I focus on ways of thinking and ways of behaving, because these two elements lead to significant change in people's lives. And for me, when I work with clients who have taken a psychedelic substance, what I noticed, and what is also confirmed by studies, is that in the period after ingesting a psychedelic substance, in a couple of weeks or even couple of months after taking the psychedelic substance, your way of thinking can be more flexible, which means that if you have any rigid thinking patterns, there is a window of opportunity after ingesting a psychedelic where targeted interventions by a skilled therapist, somebody who understands how psychedelics work, can really help make your mind more flexible. And that is the point, because a mind that is more flexible allows you to take in more information and react more adequately. So that's when it comes to the thinking patterns. When it comes to ways of behavior, remember, I'm a cognitive behavioral therapist, which means that behavior is also important for me. What psychedelics do is, because your thinking and your neural pathways work differently in the period after ingesting a psychedelic, you are also more open to doing behavioral experiments and paying attention to what happens in those experiments. So for example, if somebody was extremely shy and they had social anxiety, it would be very difficult for me to convince that person to, for example, have an experience where they go to a restaurant alone. In the period after taking a psychedelic substance, their thinking may be more flexible, which means that they may be more open to conducting an experiment like that on themselves, and also their ways of interpreting that situation will be more flexible than what usually happens.